When you're pregnant or thinking about having a baby, you want to make sure you do everything you can to have a healthy baby. There are many things you can do to make sure your baby gets the best start in life. Managing blood glucose levels, as advised by your doctor, is one of the most important components of a healthy pregnancy. High blood glucose levels may cause complications during pregnancy, early delivery, and possible future health risks for both you and your baby. There are three main types of diabetes: type 1, type 2, and gestational diabetes. Gestational diabetes is commonly known as GDM or gestational diabetes mellitus, and it's the one that occurs during pregnancy as a result of hormone changes. It usually goes away after the baby is born, and it doesn't mean your baby is going to be born with diabetes. Typically, women with gestational diabetes have no symptoms. This is why it's important that all pregnant women be tested for gestational diabetes at 24 to 28 weeks of pregnancy. Women who have risk factors for gestational diabetes should be tested earlier in their pregnancy, so it is very important to know your own risk factors. You may have an increased risk of gestational diabetes if you are aged 40 years or over, have a family history of type 2 diabetes, have had high blood glucose levels in the past, have had gestational diabetes during previous pregnancies, have previously had polycystic ovary syndrome, have previously given birth to a baby weighing more than 4.5 kilograms, are from Melanesian, Polynesian, Chinese, Southeast Asian, Middle Eastern, Indian, or Aboriginal or Torres Strait Islander background. These risks are either what you were born with or what have already happened in the past. It might be a bit frustrating as there's not much you can do to change these, but there are things you can do to have a healthy pregnancy. These include being in a healthy weight range before falling pregnant and not gaining weight too quickly in the first half of your pregnancy. So, if you are thinking about having a baby, it is very important to plan your pregnancy by speaking with your GP to reduce the risks of gestational diabetes. Being diagnosed with gestational diabetes can be upsetting. However, it is important to remember that most women with gestational diabetes have a healthy pregnancy, normal delivery, and a healthy baby, provided that their blood glucose levels are well managed. If you are living with type 1 or type 2 diabetes before pregnancy, it doesn't mean that you can't have a healthy baby. Aiming to have your blood glucose levels within the target range before and during pregnancy will help reduce the risks for your developing baby. For this reason, it is recommended to start planning and preparing for pregnancy at least 3 to 6 months before you start trying for a baby. What you can do before you fall pregnant. Use contraception until you are ready to start trying for a baby. Talk to your doctor about general pregnancy planning advice and diabetes management. Have a full diabetes complication screening, including checking your blood pressure. Have all your medications checked to see if they are safe to take during pregnancy. Aim for a HbA1c of less than 7% if you have type 1 diabetes or 6% or less if you have type 2. And aim to be a healthy weight before you fall pregnant. I understand it is not always possible to plan for a pregnancy. If you have diabetes and your pregnancy is unplanned, there is still a lot you can do to give your baby the best start in life. Early contact with your healthcare team is important and can help improve your chances of a healthy pregnancy. Regardless which type you live with, diabetes can be managed by monitoring your blood glucose levels, adopting a healthy eating plan, and doing regular physical activity. It is important that you are supported and you know what to do before, during, and after your pregnancy. Health professionals such as doctors, dietitians, and nurses can support you. After your baby is born, it is crucial for you and your family to continue with a healthy lifestyle and regular follow-ups with your GP to best manage your diabetes, or if you have had gestational diabetes, to delay and prevent type 2. Remember, it is important to visit your doctor early if you are planning to have a baby or already pregnant to give your baby the best start. For more information, please call our helpline on 1300 136 588 or visit the NDSS website at www.ndss.com.au or contact your local health services.